we are excited to bring you even more investment ideas and perspectives as a part of our 6 weeks of Groundhog. And for this segment, I'm joined by Doctors Nishit Trivedi and Terry Smith. Both Terry and Nishit are directors of LifeSciences research with us at Emerald and portfolio managers on our LifeSciences Innovation ETF. And really, one question for you both is, what do you see as the most innovative things happening within your areas of coverage within healthcare, and where do you see some of the biggest opportunities today?
On my side, we are seeing opportunities across the board in the medical devices landscape. We're seeing some great innovation in minimally invasive technologies. We are seeing some great innovation in terms of the spine technologies in orthopedics. We're seeing really exciting stuff in diagnostic world. For example, with liquid biopsy, we are able to identify cancer earlier. I think that's going to be really impactful because if you identify cancer earlier, that leads to better outcomes. We also now have minimal residual disease technology, so MRD. There is a large TAM there, and that really allows us to identify when cancer comes back after the initial surgery. So I think there are a lot of exciting areas within the healthcare landscape in medical devices, in diagnostics, newer models of care delivery, the value-based healthcare system, and we try and kind of find new innovations every day.
And Terry, the same question for you is specific to the biotech industry within healthcare.
So I talk about two things, actually. So there's the rare disease space, which is driven by understanding the cause of the disease. We have some really life-changing medicines being approved and developed by smaller biotech companies for these rare diseases. These companies can launch the drugs on their own if they need to, and they can be actually profitable within 2 or 3 years because the price point is high. The patients are actually wanting the drugs. They're beating down the door literally for the drugs, and the doctors are very willing to write these drugs that are life-changing for the patients. On the other side, historically, if a company is developing a drug for a large indication, this would be a multi-billion-dollar drug. These companies were expected to be acquired by big pharma. Lately, if they aren't acquired, there is actually a path where companies can launch these drugs on their own. We've seen a number of companies that were small or mid-cap biotechs launch what are going to be big drugs. These are going to be $4, $5, $6 billion drugs. And now that pathway is somewhat open for them, it's opened up a whole new opportunity for these smaller companies. The most important thing here is that the audience that they're going to is rather targeted. So they're not detailing primary care doctors, but these would be like hepatologists, nephrologists, oncologists. Those are the doctors that these smaller companies can actually launch drugs in a very meaningful way by themselves and become profitable, self-sustaining organizations.
All right, great. Well, thank you both very much. And please, everyone, keep a lookout for future emails from Team Emerald and more investment opinions and ideas from our very talented team.